We've turned the page on 2020. Again this week, we're asking some of our state leaders how the people they represent have handled the last 9 months.
We'll talk about telehealth, the deepening food insecurity crisis, and the prospects for the arts. Will the curtains rise again?
And we'll ask all our guests what practices that took hold during the pandemic are likely to stay.
It's all ahead, Sunday, January 3rd, 2021.
From Eyewitness News, this is Face the State, Connecticut's most watched local political program.
Good morning and Happy New Year. I'm Doobie McDowell.
And I'm Kevin Rennie. A year ago, most of us had not heard of telemedicine, and few of us had ever used it.
But the pandemic changed that, and patients and doctors seem to be embracing it. Is it here to stay? Joining us this morning with the doctor's perspective is Dr. Tichianaa Armah. She's a psychiatrist and vice president of behavioral health with Community Health Center. And here with insight from the insurance side is Robert Kosior, chief operating officer of Connecticare. Welcome to both of you. Thank you very much for being with us. Doctor,
thank you for having me.
Doctor, if I can begin with you, can you give us a sense of how telehealth and telemedicine have boomed? I mean, compare it to a year ago.
Absolutely. So, I think that what we've seen now is that it's something that was really sort of small scale and exclusively for those with the highest economic means and access to care, as well as folks who were in the VA system, really from that small scale to really being kicked in full gear, with majority of folks actually having experienced some form of telehealth at this point.
And do your patients seem to enjoy it from what you can tell? Do they seem to appreciate it?
Yes, overwhelmingly. I have so many patients who say, listen, this is not going to go away, correct? I need to have this for all the many reasons that they really needed to have it before 2020.
Mr. Kosior, this must be very good news for you because Connecticut's health insurance companies were in the forefront of advocating the innovation of telemedicine use in Connecticut. What were some of the obstacles to people adopting it before the pandemic?
I think quite honestly, it's really for lots of different reasons, not something that the providers in our Connecticut provider community really had a lot of interest with. So Connecticare, much like many of the other health insurers across Connecticut and across the country, really started to enter into relationships with national telehealth providers that were dedicated solely in terms of delivering healthcare services via telehealth. But even then, really the uptake of telehealth was really, really small up until we really ran into the COVID pandemic. And then obviously there was an explosion in the rate of utilization of telehealth services, mostly because for many people, for that short period of time when we were on lockdown, that was really the only option.
Doctor, does it, for some people, they don't have internet access. But at the same time, there are some people who have transportation issues to get to you. How does this all balance out?
Yes. So yes, there are definitely a very small fraction who don't have access to any type of technology, meaning they don't have access to audio only, so with the phone. But the majority of patients actually do have at least a telephone. There are serious discrepancies or disparities in who has access to video. So if people are getting care through telephone, then you open up the doors. So many people have access. And honestly, one of the other, if I could just sort of add to what was just said in terms of the barriers, really honestly, a lot of physicians, nurse practitioners, various healthcare providers actually had some interest in doing telehealth, but there were definitely significant barriers to getting paid for doing that work. And largely, they would actually do some of this kind of work. For instance, I might have a patient who, in fact, I did have a patient a good 3 years ago who was in the in the throes, just about to end up in a really severe manic episode, and would every year end up in the hospital with another manic episode. It wasn't until we had basically a telephone visit with that patient when she was about to have that manic episode, made adjustments to her medications, made adjustments to how frequently she would be seen, and that was the difference. She didn't end up in the hospital that year, the next year, or the year after that. But 3 years ago, that wouldn't be considered a telephone visit. That would be considered, a telephone call. But it had significant impact on the cost to the system, right? The system would have had to endure her being in the hospital. The patient herself was in severe distress and did not want to lose another
let's
several weeks of her life.
With Mr. Kosior, do you see long-term economic benefits overall? Because the cost of healthcare, of course, is expensive, but it's also health insurance companies are heavily regulated in Connecticut. Are there benefits here that might reduce the cost of insurance in Connecticut?
Well, absolutely, and this is why for many years we've really tried our best to promote telehealth as an ability to really leverage technology, and particularly as it continues to develop, to really bring much more convenience to our members, but also to deliver it, using a platform that is less expensive.
Connecticut Health Centers found in a survey they had conducted that the patients who used telemedicine were really had positive experiences. Mr. Kosior, have you found the same among your providers and also your insureds?
Absolutely. So certainly one of the things that we did when the pandemic hit and when we saw such an explosion in the utilization of telehealth is we actually did a fairly comprehensive survey of our members, because we really wanted to use this occasion as a learning opportunity to say, what does this platform really mean? What's good about it? What can we improve on it? What do our members really like about it? And I think generally what we've learned is that the overwhelming majority of our members actually like the option of having telehealth. They think that it's important, but at the same time, I think they realize that it's not necessarily appropriate for every single patient or every single interaction. But certainly, this does sort of open up sort of another way in which people can access the healthcare delivery system much more conveniently, and again, going forward, hopefully much more inexpensively.
Thank you both very much, Dr. Armah and Mr. Kosior. Thank you for providing us with some good news as the new year begins.
It's a pleasure to be with you.
Later in our program, it's been a year like no other for arts organizations. How will they survive the pandemic?
And up next, communities and volunteers have rallied to provide food for those who would otherwise go hungry and for people who've never needed it before. Our guests will tell us how they've been able to do it.